Hello, everyone. Welcome to our Office of Child Care webinar regarding the new rule. We are just waiting for some folks to trickle into the webinar. We have a couple hundred registered for today, so we want to make sure we capture as many people as possible. Thank you so much for your patience as we wait to start the webinar. Good afternoon, everyone. Welcome to the Office of Child Care's webinar regarding the new rule. Just wanted to reintroduce. We are still waiting for a lot of folks to enter the webinar today, and we want to capture as many folks as possible. So please hold. We are going to start in a few minutes. Thank you so much for your patience as we wait to start the webinar. Good afternoon, everybody. Again, just want to reintroduce as a lot of folks have entered the room. It is about 3:30 p.m. We just want to wait for a couple more minutes as we had a lot of interest in this webinar. Thank you so much for your patience. We'll start the webinar shortly.
Hey everyone, we're going to get started in just 1 minute. The numbers are still ticking up pretty quickly, so we'll give folks 1 more minute and then we will get going. Thank you for joining us today. Alrighty, I think we can get started. So good afternoon to most of you. Good morning to those of you joining us from Alaska. My name is Ruth Friedman. I'm the director of the Office of Child Care. Thank you so much for joining us today. I'm really pleased to be here with you to talk about the Biden-Harris administration's new final rule for the Federal Child Care and Development Fund program. A virtual tribal consultation was held for this proposal in July of last year. So the final rule, which was published just last Friday and becomes effective April 30th, delivers on the executive order on increasing access to high quality care and supporting caregivers, signed by President Biden in April 2023, which directed HHS to reduce childcare costs and improve childcare payment practices. It also helps deliver on the president's executive order on reforming federal funding and support for tribal nations to better embrace our trust responsibilities and promote the next era of tribal self-determination. You can go to the next slide. So for those of you not as familiar with CCDF, it is the primary federal funding source devoted to supporting families with low incomes, afford childcare, and to increasing the quality of childcare for all children. CCDF plays a vital role in supporting child development and family well-being. It facilitates parents' employment, training, and education, and improves the economic well-being of participating families. CCDF is administered by state, territory, and tribal governments and provides subsidies to help families access childcare. Nationally, about 1.3 million children under the age of 13 and 800,000 families receive CCDF each month to help them afford childcare. Many Native families receive childcare subsidies through state CCDF programs, but importantly, many tribes run their own CCDF programs with the $500 million allocation provided directly to tribal nations. We have 262 tribal CCDF lead agencies representing 545 tribal nations. And that means that more than 17,000 Native children and their families are receiving child care assistance every month from the tribal CCDF program. We know that access to affordable, high-quality childcare has numerous short and long-term benefits for children, for families and communities, because reliable access to care leads to better parental earnings and employment. It supports parents' educational attainment, and reliable access to high-quality care positively supports children's development during their most formative years. But we also all know that childcare is expensive, really expensive. And without help paying for childcare, the cost can lead parents to reduce their work hours or exit the workforce altogether, or seek out less expensive care that is less reliable or less safe. Yet at the same time, there isn't enough childcare in many of our communities to meet the needs of families. And childcare staff are some of the lowest paid jobs, despite the essential work they do every day. The importance of affordable childcare to family, businesses, communities, and to a strong economy is why the Biden-Harris administration has called for significant new investments to make sure no family in America pays more than $10 a day for childcare, and so preschool is available and free for all 4-year-olds. We want to make sure that all families can find and afford the childcare that meets their family's needs. And the significant new investments and fundamental system reform will be needed to fully realize affordable, high-quality childcare and early education for all families who need it. The rule we're discussing today takes some immediate steps to address some of the concerns we've heard about from tribal nations about the existing CCDF program. You can go to the next slide. So as you may know, last year, the Office of Child Care kicked off an initiative to fully reevaluate our rules and processes for the tribal CCDF program. We are taking a hard and thorough look at how those rules help or hinder tribal nations run CCDF programs that best meet their community needs and appropriately account for tribal sovereignty. That process is separate from what we are discussing today, and that process and its many steps are still ongoing. So for the most part, the rule that we released last week and that we're going to be talking about today, it exempts tribal nations from the new requirements that we put forward for states and territories. But it did provide an opportunity for us to lower costs for parents and provide some more flexibilities for tribes. It also makes some changes to encourage but not require policies that would mean easier and faster enrollment into CCDF for tribal families. So we look forward to working in partnership with you to make sure CCDF is a program designed to meet the needs of tribal nations. And for the tribal lead agencies on the call today, I really look forward to seeing you at our national conference in April. I am now going to turn it over to Megan Campbell, who is a senior child care program specialist here in the Office of Child Care. And she is going to walk you through more of the details of the rule. Megan?
Thanks, Ruth. And you can go to the next slide. Hi, everyone. As Ruth said, I'm Megan Campbell, and I am in the Policy, Data, and Planning Division in the Office of Child Care. And now that Ruth provided an overview of the goals and benefits of the new CCDF final rule, I am going to get into some of the specifics about the changes in the rule and that impact tribal lead agencies specifically. As Ruth mentioned, most of the new requirements in the rule only apply to states and territories, so I'm not going to go through those in detail here, but we do have more information on our resource page about all of those requirements, and we'll be posting more resources for your reference if you're interested in learning about those other pieces. So starting out, we included a couple changes for tribal lead agencies that will make it more affordable for families participating in the subsidy program. First, we are exempting all tribal lead agencies from the requirement to have a sliding fee scale that determines a parent's copayment amount. In other words, all tribal lead agencies now have the option to waive family copayments for all of the families in their program. This was an existing flexibility for tribes with small allocations, but is a new flexibility for tribes with medium and large allocations. This is not a requirement. It is at the option of the tribal lead agency whether or not they waive copays for all families, but we do encourage tribes closely consider this new flexibility. For medium and large tribes with medium and large allocations who choose to keep having a copay for their families, those copays are now capped at 7% of the family income, regardless of the size of the family or the number of children in care. Tribes with small allocations are exempt from this requirement, as tribes with small allocations have a very limited list of specific requirements for CCDF that apply to them. I want to point out that the 7% is a cap, it is a maximum. Lead agencies certainly can and are encouraged to set copayments lower than the 7%. Next slide, please. So the final rule has a couple somewhat technical weedsy changes that have to do with major renovation and construction that we think will have a very positive impact on tribal lead agencies. And I'm going to go through those pieces now. One thing as a reminder, tribes may use CCDF funds for major renovation and construction with ACF approval, but states and territories are not able to use CCDF funds in that way. So currently, for major renovation and construction projects, there is no obligation period, so there was no deadline to legally commit the construction and major renovation funds. Rather, tribal lead agencies have had 3 years to spend the funds that they set aside for these projects. We've received a lot of comments over the years and through the comment period for the NPRM, suggesting this is not enough time to complete a full project, especially considering issues with supply chains, weather delays for construction, many different things that can come up. So we've heard over the years requests for this to be a longer period of time. Therefore, in the final rule, we have effectively made it a 5-year spending period. So allowing for tribal lead agencies to have 2 more years to spend their construction and major renovation funds. As part of this 5-year period, we are adding a 3-year obligation period. So tribal lead agencies will have 3 years to legally commit those funds or obligate them, and then an additional 2 years to spend those funds. The obligation and liquidation deadlines are based on the tribal lead agency's deadlines, as with other spending. So we hope that this additional time will allow for planning and completion of these important projects that really help build supply in tribal communities and nations. Next slide, please. So the other big change we made that relates to construction and major renovation is updating the definition of major renovation. This definition applies to all lead agencies, so tribes, states, and territories, but it has a particular impact on tribal lead agencies because they're the only ones who can use CCDF funds for major renovation. Our previous definition of major renovation focused on the type of renovation that was being done. So anything that involved a structural change to a facility or significant changes to the function or purpose of a facility was considered a major renovation. We often got questions about what that actually meant and what different type of project would fall under that. And there was also a level of subjectivity in deciding that piece of it. And so we wanted to update this definition to clarify and make it easier to determine what is a major renovation versus a minor renovation. In the proposed rule, we proposed just using a dollar amount to define major renovation. So we had proposed a $250,000 cap for centers. So anything above that would be a major renovation, and $25,000 for family childcare homes. We got a lot of comments on this area, and there were two big topics that stood out. The first was that our initial dollar thresholds were too low. So you will see that we certainly listened to the commenters on that, and we increased that threshold to $350,000 for centers and $50,000 for family childcare homes. This will also be adjusted annually based on inflation. The other comments we got were that they're using a blunt dollar cap, maybe overlooked some of the differences, especially when it comes to areas with high costs of living, that where it's very expensive to do construction or major renovation, and something that under the old definition would have been considered a minor renovation, simply because of the cost would now become major. That creates a significant burden for the tribal lead agency to apply, for set the funds aside, et cetera. So what we've done is move forward more with a hybrid definition. So if the project exceeds the costs we laid out, but it does not change the structural integrity of the facility or change the function, then that would not be considered a major renovation. It would be considered a minor renovation, and that type of project could be taken on without applying for ACF approval. So we will certainly, for all of the construction and major renovation changes, we will be updating our guidance, our program instructions to really build in and address some of the additional questions that go along with these types of changes. Next slide, please. In addition to wanting to make childcare more affordable for families participating in CCDF and expanding flexibilities and opportunities related to major renovation and construction for tribal lead agencies, we are also looking at the included changes in the final rule that will hope to make it easier and faster for families to enroll in the subsidy program. We have several encouraged policies related to this area, and so partially to make it clear that these are allowable. We've gotten lots of questions over the years about whether some of these practices can even be done in CCDF, but also to show that we really believe these are steps in the right direction to make it easier for families. So the first is the allowability of presumptive eligibility. So the lead agency can consider a child eligible for up to 3 months while they are completing the full eligibility determination. We know sometimes that full eligibility determination can require parents going back and getting additional paperwork, pay stubs, et cetera. So while they are collecting that, their child can still enroll with a provider, receive the subsidy, and that parent can start working or start training or go to class immediately. And if during that 3-month period or at the end of it, the child is found to be not eligible, the lead agency does not have to pay the federal government back. This would not be considered an improper payment, so to speak. So this gives another option for helping families come into the system. Also, we make it clear that the lead agency can use documentation and verification of eligibility for another program with similar requirements as CCDF. They can use that information to help determine if a family is eligible for CCDF. Many of these different programs have duplicative questions in their applications. Using the same documentation lifts the burden and that limits the duplication for families and limits administrative lift for lead agencies. And then lastly, we are strongly encouraging the use of online applications and online document submission for enrollment. And in areas where an online application doesn't make sense or is not practicable for the lead agency, finding ways to simplify applications, not ask too many questions that aren't required, and make it easier for families to find ways to submit the application itself. Next slide, please. So as we've mentioned a couple times, there were many changes in the final rule that do not apply to tribal lead agencies. I want to highlight a few that are only applicable to states and territories, though these are not all of them. So the first is related to consumer education. The states and territories are required to post their sliding fee scales online, and we also made some clarifications about their monitoring reports and aggregate data. Tribal lead agencies are exempt from those requirements, and all tribal lead agencies continue to be exempt from the requirement to have a consumer education website. We are also requiring states or territories to use some grants or contracts to provide direct services and build supply of care for infants and toddlers, children with disabilities, and in underserved geographic areas. Tribal lead agencies are exempt from this requirement, all tribal lead agencies, but we do encourage the use of grants and contracts where it makes sense, and also taking steps to continue building the supply of high quality care. And then lastly, states and territories now must pay childcare providers prospectively, so at the beginning or in advance of delivery of services, and based on enrollment, not attendance. These are under the umbrella of provider payment practices. Tribal lead agencies are exempt from this requirement, though we encourage continuing practices that help to stabilize and support childcare providers. Next slide, please. So now looking ahead. First, I want to point out that we have a resource page that includes summaries, including a summary specific about the final rule's impact on tribal lead agencies and a red line of the regulatory language. We will be adding more resources, including the recording and the slides from this presentation, and the recording and slides from today's earlier general presentation. We also hope to add frequently asked questions and topic-specific fact sheets in the near future. As Ruth mentioned, the rule is effective in 60 days, so it's effective April 30th, 2024. We know that many lead agencies may need more than 60 days to implement some of these high impact policy changes. So we are allowing them to apply for transitional and legislative waivers that last for up to 2 years. We will be start accepting those requests in May 2024. I'll point out that most of the changes for tribal lead agencies are new flexibilities, so we wouldn't necessarily expect the need for a waiver request, but all lead agencies have the option to put in waiver requests for the new provisions that have come through the final rule. We will soon release more resources about the final rule, about the waiver process, and how they work together. So with that, that concludes our presentation. I know I just said it, but I'll reinforce we will be posting these slides on our summary website. Thank you so much for attending today, and thank you for your continued partnership as we work to implement these changes to help support families and children and childcare providers. Thanks, and have a great rest of your day.